Okay, everybody, can you see the PowerPoint?
Yes, sir.
Okay,
Yes,
and
so
okay, and how is my voice? Am I audible to everyone?
Yes, sir.
yes,
Yes,
so
sir.
Okay, okay, then it's good. I'll start the discussion today. Today we are discussing the bones of lower limb. Okay, so it's a sort of revision class for the preparation of your examination. Okay, university practical examination. Bones of upper limb, I don't need to tell here the names. I think you know the names of the bones of lower limb, not upper limb. We are discussing today the lower limb. Uh, so one by one, all these bones we'll try to review quickly in today's class. Okay. Yes, first of all, I'll describe the hip bone. Hip bone, uh, as you know, in the examination, you have to keep all the bones in the anatomical position and you have to determine the side of the bone. Okay, so first of all, I am describing the anatomical position along with this, the side determination of the hip bone. Hip bone, also known as the os coxae, also known as the innominate bone or os innominatum. Okay, so for the anatomical position and site determination, you have to keep the bone as instructed. The acetabulum, as you know already, acetabulum is lying on the lateral part of the bone, near the junction between the ilium, ischium, and the pubis, should directed laterally. Okay, and obturator foramen, this also you know already, you have discussed it, you have seen it. So this is a foramen here in the diagram, you can see this one is the obturator foramen. So obturator foramen lies below the acetabulum. Okay, and flat expanded ilium, upper part of the bone is the ilium. Ilium is directed upward and thin pubis is directed anteromedially. See, this is the pubis and this one is the ilium and this one the ischium. These parts I'll explain later after doing the anatomical position and the side determination of the bone. So thin pubis is directed anteromedially, thick ischium is directed postero-inferiorly. So this one is the ischium. Okay, it is directing postero-inferiorly. Pubis must direct anteromedially. Okay, and ilium should lie superiorly. See, this is ilium, superiorly it is facing, and this is the pubis, it is facing anteromedially, and this one is the ischium, which is facing postero-inferiorly. Okay, and there is pubic tubercle, uh, which you know. See, this one is the pubic tubercle. This pubic tubercle and anterior superior iliac spine. This one is the anterior superior iliac spine. These structures should lie in the same coronal plane. Okay, pubic tubercle and ASIS, anterior superior iliac spine, should lie in the same coronal plane. And when you are keeping like this, then the ischial tuberosity occupies the lowest position. This one is ischial tuberosity, which should occupy the lowest position. So when you maintain all these things while holding the bone, then this is called the anatomical position of the bone. And with the help of the anatomical position, you can determine the side of the bone. Which side bone is there in the diagram? Can you tell to me? Any one of you?
Right
Which side
side.
bone is there? Right
Right.
side. Very good. Very good. This one is the right side. Yes. So remember these facts. In examination, you have to do this. Okay. And then you have to show it, demonstrate it, and you have to tell the side as well as. Okay. After this, you have to know the general features of the bone. General features means what are the bony parts in this bone. This I am explaining one by one. I'll take your help also to discuss in between. Okay. So first of all, you have to know the hip bone is divided into the hip bone consists of the three parts. Okay, this you know. So largest part is the ilium, the upper part here, the blade also you can say of the hip bone. This one is the ilium. Okay, and another part is the pubis. This part is the pubis. Anteromedially it is present, and postero-inferiorly lying part, this one is the ischium. This one is ischium, this one is pubis, and this one is the ilium. Okay, And now here you can see in the diagram, see in the ilium, what are the parts you can see, or what are the parts you must know for the examination. See here, ilium has the three borders. You can see the three borders of the ilium. What are the three borders? See here, this one is the anterior border. I'm tracing the anterior border. And now see posteriorly, this one is the posterior border. And medially, there is medial border. This one is the medial border. So these are the three borders of the ilium. Okay. And superiorly, you can find upper end of the ilium. See, this one is the upper end of the ilium. The upper end of the ilium is also known as the iliac crest. And this iliac crest extends from the anterior superior iliac spine. This one is the anterior superior iliac spine to the posterior superior iliac spine. This whole part is known as the iliac crest. Okay, and this one is the lower end. This one is the lower end. Lower end of the ilium joins with the anteriorly to the pubic part and posteriorly to the part of the ischium. Okay, so these are the two ends, upper end and the lower end and the three borders. Now come to the surfaces. The surfaces are, see, three surfaces you can find. This one is the iliac fossa, this one, okay, and this one is the sacropelvic surface, this one. I'm tracing with the cursor, you follow the cursor, okay. This one is the sacropelvic surface, and on the other side, dorsal side, this one is the gluteal surface. So three surfaces are iliac fossa, sacropelvic surface, and the gluteal surface, okay. And now here, what are the other most known parts? See, this iliac crest. Iliac crest is divided into the two segments. Only the ventral segment, anterior to third part, is known as the ventral segment, and posterior one third part is known as the dorsal segment. Okay, and ventral segment, you have already learned, it is divided into the three parts. What are the three parts of the ventral segment? This one is the inner lip, and other side here on the diagram you can see outer lip. This one is outer lip, and in between the two lips, inner lip and outer lip, there lies the intermediate area. And now come to the dorsal segment. Dorsal segment is the posterior one third. A part of the iliac crest is the dorsal segment. It is divided into the two parts. One is the inner sloping surface. See here, this is inner sloping part, and the one is the outer sloping part. Okay, and all these parts provides attachments to the different structures, different muscles. These attachments, after telling the general features of the bone, I will describe. Okay, so first of all, you have to know the general features. At least to pass the examination, you have to answer properly the general features. If you are not answering the general features, then difficult to give you the pass marks. At least if you answer the general features, will give you the pass marks. Okay, this is the standard of taking the examination. And then see, after this, anterior superior iliac spine, below the anterior superior iliac spine, if you trace the anterior border, then you can reach till to the anterior inferior iliac spine. This one is the anterior inferior iliac spine. Similarly, if you go posteriorly, see, this one is the posterior superior iliac spine here, this one. Okay, if you trace the posterior superior iliac spine, then you will reach till to the posterior inferior iliac spine. Okay, and if you trace the posterior inferior iliac spine more downward, then you will reach to the greater sciatic nodes. See here, this one is the greater sciatic nodes. This one is the greater sciatic nodes, which is a part of the posterior border of the, you can say, ilium. Okay, so this one is the greater sciatic nodes. Till here is the ilium. Below this, if you trace the greater sciatic nodes, you will reach into the part of the ischium. At the same time, you can trace it as well. Okay, so this one is the ischial part. The blue part is the ischial part. Okay, and this part of the ischium, which is continuous with the greater sciatic nodes, is known as the ischial spine. See here, this spine is the ischial spine. Okay, and if you trace the ischial spine more inferiorly, you will reach to the lesser sciatic nodes. This one is the lesser sciatic nodes. Okay, And after tracing the lesser sciatic nerves, it reaches to the ischial tuberosity. This one is the ischial tuberosity. Okay, this one is the ischial tuberosity. Very very important part of the ischium. This one is ischial tuberosity, and here you can see this blue part is the ischium. Before going into the ischium, I'll finish all the parts of the ilium. See, this is the iliac fossa. This is the iliac fossa, and here sacropelvic surface you can see it is having the here inferiorly the rough smooth part. This is known as the auricular surface. Okay, this is known as the auricular surface. In superiorly there is the rough part which articulates with the sacrum. So here you can see this is the sacral iliac tuberosity. Here you can find out this articulates with the sacrum and provides attachment to the ligaments in between the sacrum and the ilium. Interosseous ligament lies there, iliolumbar ligament. Also some of the parts comes here. Okay, so this rough part is for the attachment of the ligament, and here inferiorly and anteriorly placed part. This part is the auricular part. This part is the auricular part. This is for articulation to the sacrum. Okay, upper part, rough part is for providing the attachment to the ligament, and lower and anterior part, this one, the smooth part, is for articulation to the sacrum. This part is known as the auricular surface of the ilium. Okay. So after this, I'll take you into the here. Okay, the dorsal surface of the ilium. In the dorsal surface of the ilium, this part is also known as the gluteal surface, and here you can see three gluteal lines you can find out here. So this one is the posterior gluteal line. See here, posteriorly, this one is the posterior gluteal line, and another gluteal line is the anterior gluteal line. After the posterior gluteal line, this one is the anterior gluteal line, and another gluteal line below the anterior gluteal line, you can see this one is the inferior gluteal line. So there are the three gluteal lines: posterior gluteal line, anterior gluteal line, and inferior gluteal line on the dorsum of the you can say ilium. All right. So these three lines divide the dorsal surface of the ilium, or posterior surface of the ilium, or gluteal surface of the ilium, into the four parts. This is posterior part, and this is a part in between the posterior gluteal line and anterior gluteal line, and between the anterior gluteal line and inferior gluteal line there is another part, and between the inferior gluteal line and the acetabulum there is another part. Okay, so these parts provide attachment to the different muscles. What are the muscle attaching there? Later in the diagram I'll tell to you. And here at the same time, which is also the most known part of the iliac crest, which lies about 5 centimeters behind the anterior superior iliac spine, the outer lip. This part is the iliac tubercle. This part is the iliac tubercle. Okay, this part is the iliac tubercle. And after this, come to the ischium. This one is the ischium. Here I'll explain you the most important part of the ischium, most known part for the examination is this ischial tuberosity. You have to know the parts of the ischial tuberosity. Ischial tuberosity at first is divided into the two parts: upper quadrilateral area. See here, this whole part is the ischial tuberosity. It is divided into the two parts. Upper part is the quadrilateral. This one is quadrilateral. It is divided further into the two parts by oblique ridge. This one is the oblique ridge. One is the this one postero, you can say medial part. Other is the posterolateral part. Okay, so it is divided into the two further parts. And then now inferiorly, this one is the triangular part. This one is the triangular part. Triangular part is again divided into the two parts by the on ridge. Okay, median ridge. Here you can see this ridge divides the triangular part into the lateral part. This one is the lateral part, and this one is the medial part. Okay, this one is the lateral part, and this one is the medial part. Why I am telling all these parts are because here there are the attachments of the different muscles. Which muscles I'll tell you later in the diagram. And now here come to the pubis. This one is the pubis. Okay, this one is the pubis. Pubis has body. This one is the body of the pubis. Body of the pubis. Body of the pubis consists of the three surfaces. Here you can see three surfaces of the pubis. The one which is facing toward the pelvic surface, towards the pelvic cavity is known as the pelvic surface. This one is pelvic surface, and this one is the symphyseal surface, which articulates with the under pubis in the midline. This forms the pubic symphysis here. Okay, so this one is the symphyseal surface, and anteriorly there is the anterior surface. Anteriorly there is the anterior surface, and here some of the borders of the pubis you can see. This one is the this line is the, what is this line? This line is the pectinate line. Okay, some of the margins, important margins here in the pubis you can see. This one is the pectinate line. Pectin pubis also you can say. Pectineal line also you can say. If you say, trace this pectineal line superiorly, it will reach till to the this one, iliopubic eminence. Here, this part is the iliopubic eminence. Okay, and after further tracing this pectineal line superiorly into the ilium, you will reach here into the another line of the ilium. This is known as the arcuate line. Now here you can see this arcuate line, iliopubic eminence, and pectineal line of the pubis. Pectineal line of the pubis together will form the part of the inlet of the pelvis or pelvic rib. Below this line, okay, below this line, this part represents the pelvic cavity. If you join two bones and posteriorly between the two bones there lies the sacrum. Okay, and if you see whole articulation together, this is known as the pelvic cavity. Bony pelvis at first, and then the part below the pelvic brim is known as the pelvic cavity. Okay, so here what is this line? This one is the arcuate line. What is this part? Iliopubic eminence. What is this part? This part is the pectineal line of the pubis. So these three parts very, very important, because this is forming a part of the pelvic brim or inlet of the pelvis. Okay, and below this part it forms the pelvic cavity, and above this part it forms the false pelvis. Okay, this is the part, iliac fossa is a part of the false pelvis, and this part is the part of the, this part means pelvic cavity is the true pelvis below the pelvic brim. And anteriorly here you can see another ridge or another line. This line, this line here, this one is going toward the obturator foramen. This is known as the obturator crest. You can see this from the anterior side. This part is known as the obturator crest, and this obturator crest is here in the lower part of the acetabulum. Okay, all these things you have to know. Very, very important part for the viva. And now see, here the pubis has two ramus. This one is the superior ramus of the pubis. These things you can see in the superior ramus of the pubis, the pectineal line, and what is next? This one is the obturator crest. This thing you can see in the superior ramus of the pubis. Okay, and this one is the inferior ramus of the pubis. And this inferior ramus of the pubis joins with the ramus of the ischium. Together, here you can see joining between these two bones. Together, this is known as the ischiopubic ramus. This ischiopubic ramus also provides attachments to the different muscles. Okay, and now see, in between these two bones, pubis and the ischium, there lies the obturator foramen. This is called obturator foramen because it is closed by the membrane. The obturator means closing. It is closed by a membrane, so that it is known as the obturator foramen. Okay, everybody, are you listening to me? Are you hearing?
Yes, sir. Yes, sir.
Yes, sir.
Yes. Okay, okay, then it's good. Yes, okay, so what is the obturator foramen? Obturator foramen is a foramen which is lying in between the pubis and the ischium. Okay, this one is the obturator foramen. If you see this foramen in the male, it is larger, okay, than in the female. Okay, and this obturator foramen in male is triangular in shape. Sorry, not triangular, oval in shape, whereas in female is oval, triangular in shape. Like this, some sexual dimorphism we can do. These sexual differences we'll study later in the bony pelvis in the third semester only, but later one. Okay, but for your examination, this sexual first year examination, sexual dimorphism at present is not required. So I'll not elaborate these things. Now come to here acetabulum. This is called acetabulum. See this part, this cup-shaped structure is known as the acetabulum. In Latin, acetabulum means a vinegar cup. Okay, it is like cup-shaped. So it is known as the acetabulum. Acetabulum is contributed by all the three bones. Here you can see from the upper two-third, it is contributed by ilium, and posterior two-third part is contributed by the ischium, and anterior one-third part is contributed by the pubis. So again I am repeating, upper two-third part is contributed by ilium. See here, this is iliac part, and this one is the ischial part. Posterior two-third part is contributed by ischium, and anterior two-third part is contributed by pubis. Okay, and here if you see the developing acetabulum, you can see triradiate line at the line joining these three bones. There is presence of one cartilage. Okay, but later on it will ossify. This cartilage is known as the triradiate line. Now also you can see this line, which is marked by the different color. It is in the form of Y-shaped line. So this is known as the triradiate line. Okay, triradiate line. And here within the acetabulum you can see distinctly three features. See, this one is the lunate fossa. Okay, this one is the lunate fossa. This lunate fossa articulates with the head of the femur from the which joint? Hip joint. So this smooth part, which is lying towards the outside, see this smooth part is articular part of the acetabulum, articulating part of the acetabulum forming the hip joint. Okay, and centrally there is a fossa. There is a fossa. This is called acetabular fossa. This is non-articular part. In this part there is the pad of the fat. Some deposition occurs there. Okay, and inferiorly between the two ends of the acetabulum, here you can see two ends of the acetabulum. This anterior end and this one is the posterior end. There lies a notch. This notch is known as the acetabular notch. Already you have studied in the hip joint. This acetabular notch is bridged by a ligament. This ligament is known as the transverse acetabular ligament. Okay, and there is foramen inside the ligament. This foramen is known as the through this foramen there is passing of the acetabular artery to supply to the ligament of the head of the femur, isn't it? Which extends from the you can say here transverse acetabular ligament to the there is a fovea in the center part of the head of the femur. Till there it extends, which is triangular in shape. So this artery which is passing through this gap will enter into this ligament and supply to this ligament. Okay, ligament of head of femur, also known as the ligamentum teres femoris. So this is very important part here. The gap is very important. All right. So this is the lunate impression, and in between what is there? There is the acetabular fossa, and then inferiorly what is there? There is the acetabular notch. So these features you have to know, and this sharp margin of the acetabulum is also important because here there gives attachments of the acetabular labrum. Is that it? The fibrocartilage. This acetabular labrum attaches here, and this acetabular labrum provides you can say along with this acetabular cavity more place for articulation to the head of the femur, congruent articulation to the head of the femur, you can say, and this is holding the head of the femur. Okay, the acetabular labrum along with this acetabulum provides congruent articulation to the head of the femur and provides stability to the head of the femur, forming the which joint? Hip joint. So this acetabulum is very, very important. You learn it properly. All right, and after this we'll go into the attachments. Important attachments I'll tell, which are most known attachments for the examination. Okay, I'm starting here from the anterior superior iliac spine. So what are the structures attached here in the anterior superior iliac spine? You can see here. You can see here anterior superior iliac spine. In the upper part In the upper part, there is attachments of the inguinal ligament. See here, this is inguinal ligament. The green area is for the attachments of the lateral end of the inguinal ligament. Okay, and inferior to the attachments of the inguinal ligament in the ASIS, anterior superior iliac spine, there is origin of the sartorius. This is origin of the sartorius. And another important attachment which you must know is onto the anterior inferior iliac spine also. Come below the anterior superior iliac spine, then you reach there into the anterior inferior iliac spine. And here in the upper part there is the attachments of the rectus femoris, straight head of the rectus femoris, which is one of the component of the quadriceps femoris, which lies in the front of the thigh, isn't it? Even the sartorius also muscle in the front of the thigh. So rectus femoris attaches here in the upper part of the anterior inferior iliac spine, and inferior to this there is attachments of the iliofemoral ligament. Strongest ligament of our body is the iliofemoral ligament. See, this iliofemoral ligament attaches here into this part. What is this part? Anterior lower part of the anterior inferior iliac spine. So these two areas are very important during the higher time. Attachments in the anterior superior iliac spine and attachments in the anterior inferior iliac spine. Okay, and now I am taking you towards the iliac crest. See, this is the area of the iliac crest. Iliac crest, we have divided the ventral segment into the three parts: medial lip, lateral lip, and in between what is the intermediate area. So first of all, I am showing you the attachments in the lateral lip or the outer lip. Outer lip also you can say to the lateral lip. Outer lip, better to say here. Okay, that will be easier to understand. So in the outer lip, ventrally means ventral to the iliac tubercle. Here there lies the iliac tubercle. There is attachments or origin of the tensor fascial artery. You can see here. This is the tensor fascial artery. Okay, and in the intermediate area, not in the intermediate area, still in the outer lip. There is insertion of the external oblique muscle. This is the muscle from the abdomen. Already I have explained to you in the anterior abdominal wall. This is a part of the third semester, but we'll ask in the viva relating with the iliac crest. Okay, so you remember this muscle has the external oblique attaches or inserted here into the outer lip of the iliac crest. It is ventral to third part. And now this internal oblique originated from the intermediate area of the iliac crest. See here, this one is the intra-oblique muscle of the abdomen, which is originated from the intermediate area of the iliac crest. Okay, and if you go into the inner lip, okay, here and the diagram you can see this one is the inner lip. Inner lip provides origin to the transversus abdominis muscle, right? And if you go into the posterior part of the inner lip, there is origin of the quadratus lumborum muscle. And if you go more posteriorly towards the you can say dorsal segment, there is attachment of the erector spinal muscle. Okay, and here you can see attachment of the iliolumbar ligament. Here you can see the sacropelvic area. And you can see attachments of the dorsal sacroiliac ligament, interosseous sacroiliac ligaments. These are also there. All right. And now I am going there into the iliac fossa. In the iliac fossa, there is origin of the iliacus muscle. Okay. And gluteal region you can see in this diagram. First diagram, you can see the gluteal region. The gluteal region posteriorly, there is origin of the gluteus maximus. Posteriorly means posterior to the posterior gluteal line. This one is the posterior gluteal line. Okay, and this is the gluteus maximus. And in between the posterior gluteal line and anterior gluteal line, this area gives origin to the gluteus medius. And inferior to the anterior gluteal line, or you can also say in between the anterior gluteal line and the inferior gluteal line, this is the area for the gluteus minimus. All right, and inferior to inferior gluteal line, superior to acetabular margin, this area gives attachments or origin to the reflected head of the rectus femoris. Straight head is from the anterior inferior iliac spine. Reflected head is from the this area below the inferior gluteal line and above the acetabular. So these attachments you remember, And then now we'll go into the bone. The bone means we'll go first of all into the ischium. Okay, ischial attachments are very important, mainly the ischial tuberosity. Ischial tuberosity we have divided into the how many parts? First of all, two parts: upper quadrangular area and lower triangular area. From the upper quadrangular area, you can see origin of the three muscles. First of all, you can divide it into the two part. See, this is for the semimembranosus, superolateral part for the semimembranosus, and inferomedial part of the upper quadrangular part is for the origin of the semitendinosus. Along with the semitendinosus, there is origin of the long head of the biceps femoris. Okay, and you can come here into the lower triangular area. From the lower triangular area, you can divide it into the two parts: only the lateral part, only the medial part. From the lateral part, there is origin of the ischial head of the adductor magnus, and medial part it is covered by the fibrofatty tissue, and this medial part is transmitting the weight to the ground when we are sitting. Okay, so this is the importance of the medial part of the lower triangular part of the ischial tuberosity. This is very important part. You remember all these muscles along with the division of the areas. Okay, ischial tuberosity, what you have to say, first of all, divided into the two parts: upper quadrilateral part or quadrangular part and lower triangular part. Upper quadrilateral part is further divided into the two parts by a ridge, obliquely placed ridge. These parts are the superolateral part and the inferomedial part. Superolateral part, there is origin of the semimembranosus muscle, and from the inferomedial part, there is origin of the semitendinosus and long head of the biceps femoris muscle. Triangular part, you come again, and here it is divided into the two parts: lateral part and the medial part. From the lateral part, there is origin of the ischial head of the adductor magnus. Okay, and here in the diagram, you can see muscles which are attached there into the iliac crest, which already I have explained. Again, you can read. I'll share. Now, after this, these are the main parts of the hip bone. If you answer these many things, then you can easily score good marks. Okay. Now come to the ossification of the hip bone. There are the three primary centers for the ossification of the hip bone: one for the ilium, one for the ischium, and one for the pubis. Okay. And at the age of the 18th year, all these three parts will fuse together to form the single bone. Then it is known as the hip bone. Okay, in the beginning, ilium, pubis, and ischium, they are separately placed. Later on, at the age of the 18th year, only they are fused together to form the single entity or single bone. And there are the secondary centers appear for the different parts of the ilium, ischium, and the pubis. And here you can see some of the secondary centers. There are the two secondary centers for the iliac crest, and there are the two secondary centers for the Y-shaped acetabular cartilage, which is joining the three bones. Okay, here you can see Y-shaped acetabular cartilage joining the three bones. And there is one secondary center for the ischial tuberosity. I hope you all know what is primary center and what is secondary center of ossification. Primary center means it is ossifying, it appears before birth. And secondary center, this appears after birth. Secondary center appears in the epiphysis. Primary center appears in the diaphysis. Like this we have defined to you, isn't it? While doing the general anatomy of the bone. So this fact also you have to remember here. In the Viva, we will correlate all these basic concepts together. We'll ask. So you have to answer all these things. And now, age of the appearance of this, you can say, secondary center is during the puberty, and age of fusion will be 20 to 25 years. They are fusing with their main body. Like here you can say iliac crest is separately lined till the 20 years. After 20 years it will fuse completely with the ilium. Okay. Similarly, ischial tuberosity also fuse here at the age of the 20 years. Okay, with the ischium. And like this, other secondary center fuse with their main part to give the adult bone. Okay. And now, I'll go into the femur. Now I'll go quickly because time is less. I hope you know major parts of these bones comparatively these long bones are easier than the hip bone, so I took long time for the discussion of the hip bone. Now femur, tibia, fibula, I'll go quickly. Okay, so anatomical position, how to hold the femur. See, femur you can hold in the index finger here at the neck, okay, of the same side hand. Okay, suppose see you got the femur of the right side, then you can hold the femur with the right index finger, then it will be automatically in the anatomical position. All right. Similarly, if you get the left side femur, then you can hold the left side femur with the left index finger holding at the neck. Okay, and you can so demonstrate to the teacher. So this much only I'll tell to you. Rest of the thing you can read it later. What are the general features of this femur? General features include, see, there is upper end, lower end, and in between there is the shaft. In the upper end you can see what are the parts of the upper end. Here you can see head, okay, and this one is the neck, and anteriorly you can see this is greater trochanter, this one is the lesser trochanter. In between the two trochanter, what is there? There lies the intertrochanteric line. Posteriorly, what is there? There lies the intertrochanteric crest. Okay, and here in the greater trochanter, if you go medially, there is very important structure. This is known as the trochanteric fossa. Greater trochanter, what is there? Medial surface, there is the trochanteric fossa. Okay, and superiorly here you can see upper border of the greater trochanter, and this one is the lesser trochanter. And now come to the shaft. Come to the shaft. This one is the shaft. In the shaft posteriorly, there is very important feature of the shaft. This one is the linea aspera. Linea aspera. Closer to the linea aspera, posteriorly you can see nutrient foramen as well. Okay, see this one is the nutrient foramen. And superiorly here you can see linea aspera. Two lips are diverging. One goes laterally and another goes medially. Okay, the lateral lip of the linea aspera continues upward with the gluteal tuberosity. Here this part is the gluteal tuberosity. This provides attachments, insertion of some of the fibers of the gluteus maximus. Okay, and here the medial lip, if you trace superiorly, it will reach to the spiral line. This line is the spiral line. Here this line is the spiral line. All right. What is this line? Spiral line. Here, what is this one? Gluteal tuberosity. And trace these two lips of the linea aspera inferiorly. If you trace the medial lip, you will reach till to the medial supracondylar line. This one is the medial supracondylar line. If you trace the lateral lip, you will reach till to the lateral supracondylar line. And now here, between these two lines, gluteal tuberosity and the what is this spiral line, there is the posteriorly placed surface. Okay, see here you can say posterior surface. Okay, this part is the posterior surface of the femur in the upper part, and this one is in between the two supracondylar line. This is known as the popliteal surface. Okay, and if you count the borders and the surfaces in the shaft, you find three borders and the three surfaces. Three surfaces are the anterior surface, medial surface, and the lateral surface. Three borders are similarly medial border, lateral border, and the posterior border. Posterior border also known as the linea aspera. And now come to the lower end. Lower end, the important features are the condyles. Okay, see these are the two condyles, lateral condyle and the medial condyle. Lateral condyle and the medial condyle. Okay, and in between the two condyles there is the intercondylar fossa. You can see this intercondylar fossa when you look the femur from the posterior side. This one is the intercondylar fossa, and there is a line also between the two. Hello.
Yes, sir.
Hello. Okay,
Yes.
everyone, are you there? There was internet disconnection because of the current cut. Now it came. So I'll start discussion again. Okay. So can you see the PowerPoint again? Are you seeing the PowerPoint?
No, sir.
No.
No,
No.
sir.
Then I have. Okay. Okay. I'll share it. Just a minute. I'll share it. Um, did you already share the presentation? I have to share it again. Okay. Can you see now?
Yes,
Yes,
sir.
sir.
Yes.
Okay, okay. So these are the things which you have to know in the femur. Okay, a shaft you have to know, lower end, upper end you have to know, and then features of the upper end, lower end as well as shaft you have to know, and some of the attachments, some of the important points here I'll tell. See this angle between the neck of the femur and the long axis of the body of the femur is known as the angle of inclination. In this diagram you can see angle of inclination is 125 degree in adult. Okay, and in children it is more, it will be 160 degree. Okay, and another angle which you have to know is angle of torsion, angle of femoral torsion. This is angle in between the transverse axis of the femoral condyles. See here, this is the transverse axis. Red line represents the transverse axis of femoral condyle, and this blue line represents the long axis of the head and neck of the femur. So angle between this is known as the angle of torsion, femoral torsion. This is 7 to 12 degree. Okay. So these two angles you remember, and then some special features you have to learn quickly. I am telling. See here, if you see the greater trochanter, at the apex of the greater trochanter, there is the insertion of the piriformis muscle, and if you see the anterior surface of the greater trochanter, there is the insertion of the gluteus minimus. If you see the lateral surface, what is there? There is the insertion of the gluteus medius. Okay. And if you go into the trochanteric fossa, there is insertion of the obturator externus muscle, and little superior and anterior to this obturator externus, there will be insertion on the medial surface of the greater trochanter, insertion of the obturator internus along with the gemellus muscles. Okay, and the important muscle which you have to know is here into the lesser trochanter. In the tip of the lesser trochanter, there is insertion of the psoas major muscle. This is psoas major muscle. So after this, here in the yes, here in the anterior surface you can see the major area of the anterior surface of the femur is providing origin to the vastus intermedius. Okay, and towards the spiral line there is origin of the what is this one vastus medialis. This is intertrochanteric line, medial part of the intertrochanteric line. There is origin of the vastus medialis. This will continue downward toward the spiral line as well as medial lip of the linea aspera. Okay, and similarly here in the lateral part of the intertrochanteric line, you can see origin of the vastus lateralis. This will also continue downward, originating from the lateral lip of the linea aspera. Okay, in between there lies the gluteal tuberosity also. So all these things, all these basic concepts, general special features of the femur, you keep in mind. And then here you can see linea aspera. So many muscles are there attaching here into the linea aspera. Count. Starting from medial to lateral, you can see there is attachments of the you can see vastus medialis, and what is this intermuscular septum, medial intermuscular septum at first, and then adductor longus, again pectineus, and then you can see attachments of the adductor brevis. Okay, and adductor magnus as well. Yeah, and here you can see attachment of the posterior intermuscular septum, and you can see attachments of the lateral intermuscular septum as well as biceps femoris, and then vastus lateralis. So these are the vastus intermedius. So these are the muscles which are relating there with the linea aspera. So some of the muscles you have to remember, major muscles, vastus lateralis, medialis, you can easily say in the medial deep, lateral deep of the linea aspera, isn't it? And then other muscles also, whatever I have showed here, please keep in mind. And ossification of femur, you can read. I'll share the slide and later you can read these things. I'm not going to stand here describing the ossification of femur. This fracture of the neck of the femur also you can read. There will be fracture of the neck of the femur, and this fracture sometimes will lie intracapsular and sometimes extracapsular. This is explained here. You can read. Already we have discussed enough. Okay, but for your revision you can again read. And there is one medical legal significance of ossification center at the lower end of the femur. What is this? The secondary center at the lower end of the femur is unique in the sense that it appears during birth or just before birth. It is of medical legal importance because its appearance in radiograph indicates the maturity of the fetus. Okay, if it is appeared, then you can say the fetus is maturely aborted or naturally died. Like this, you can provide some evidence, medical legal evidence. Now patella. Here in the patella, you know the parts of the patella. I know this, but here determination of patella always will ask. Okay, so how to determine the side of the patella? See here, this one is the patella. Patella, if you see the posterior surface, it consists of the two area, lateral area and the medial area. Okay, lateral area, lateral facet you can say, and this one is the medial facet. Lateral facet is larger facet. Okay, when you keep the patella on the flat surface in such a way that apex is pointing away from you and base is towards you, then it will tilt towards the lateral surface. Okay, and if the lateral surface is tilting towards the right side, then this is the right patella, and if lateral surface is going towards the left side, then this is the left patella. Like this, you have to identify the side of the patella. Very, very important question for the Viva examination. Side determination of the patella. Okay. Other than this, you study these attachments which are shown here in the diagram. You can see vastus intermedius, vastus medialis, vastus lateralis, rectus femoris are attached into the different parts of the patella, and inferiorly there is attachment at the apex. This is the ligamentum patelli. Okay, it is said ligamentum patelli is the extension of the tendon of the quadriceps femoris. Okay, this ligamentum patelli from the apex of the patella will extend downward to the tibial tuberosity. This also you have already seen, you have already studied. So keep these things in mind again. And now clinical anatomy of patella, there will be fracture of the patella, and as you know, patella is a sesamoid bone, and this is not covered by the periosteum. So if there is fracture of the patella, then since periosteum covering is not there, so there will be you can say difficulty in healing of the patella, because in periosteum there will be blood, and these blood vessels as well as some osteogenic cells also will be lying there in the periosteum. This will help in healing of the bone, but here this is lacking. So there will be no reunion of the fractured segment, as well as there will be problem in the or delay in the healing of the patella because of this peritoneal divide in the patella. Okay, this fact you have to remember. And sometimes there will be abnormal ossification of patella. This gives like two patella, three segments of the patella, like this appearance in the X-ray. This type of condition is known as bipartite patella or tripartite patella, etc. It is written here. You can read it later. Now come to the tibia. In the tibia, the anatomical position. See here, you have to remember the medial malleolus of the tibia. Most importantly, you have to remember the medial malleolus of the tibia. Then tibial tuberosity. This should look anteriorly, and medial malleolus should go medially. Okay, and then you can determine the side of the tibia. Okay, medial malleolus is found by the tibia. It should go medially. Okay, and this one number 7 is the tibial tuberosity. It should look anteriorly. Then after holding in this way, you can determine the side of the patella. Tibia. What are the general features? Superiorly here you can see upper end of the tibia, inferiorly lower end of the tibia, and in between there is shaft of the tibia. In the upper end you can see two condyles, lateral condyle, medial condyle, and similarly in the upper end there is tibial tuberosity. In between the two condyle, if you see the upper surface of the tibial condyles, there is intercondylar area. Okay, and here on the posterior surface of the medial condyle you can see group for the semimembranosus. And here in the posterior surface of the which condyle is this lateral condyle, you can see group for the tendon of the popliteus. And posteriorly here in the upper part of the shaft you can see soleal line. Okay, and if you come here anteriorly, anterior border you can see, lateral border you can see, and then medial border you can see in the tibia. Three borders. These are the anterior border, medial border, and the lateral border. Lateral border is also known as interosseous border. This you have to remember. And surfaces are medial surface, and what is this one? Lateral surface, and posteriorly there is the posterior surface. And in the posterior surface you can find the gluteal foramen. Okay. And if you come inferiorly, see inferiorly there is medial malleolus, very very important structure. And in the posterior side of the medial malleolus, there is groove for the tibialis posterior tendon. Again, there is a significant groove, very prominent groove, which is for the tibialis posterior tendon. You can see all these structures which are attached in the tibia. The most importantly, this part you have to know. Before also we have discussed in the classroom. Say grace before T, which is attached there in the upper part of the medial surface of the tibia. Okay, yeah, same in sartorius, and then gracilis, and then semitendinosus. Okay, these three muscles are forming the gyros from upper side, pulling the tibia to upward. This you have to remember. Okay. And ligamentum patelli attached here into the tibial tuberosity, and tibialis anterior you can see originated from the lateral surface of the what is this one, tibia. Okay, and here anteriorly you can see several structures crossing the ankle joint. What are these several structures? We have discussed with one name only, isn't it? Tall husbands are neighbor, dear person. Like these several structures are there. You can read all these things. Tibialis anterior extends the hallucis longus tendon, and what is this anterior tibial artery, and what is this one anterior tibial nerve, and what this one extends the digitorum longus tendon, and this one is the peroneus dorsalis tendon. Similarly, from the medial side also you can see Tom, Dick, and Harry. Again, the medial side. What is Tom, Dick, and Harry? Now you can tell. Okay. Later you practice this one. Now here in the upper surface of the tibia you can see several structures attaching. From anterior to posterior you can see attachment of the medial meniscus, cruciate ligament, and lateral meniscus, anterior in the lateral meniscus, posterior in the medial meniscus, posterior in cruciate ligament. Okay, that is posterior in cruciate ligament. This is posterior cruciate ligament. Like this you have to learn this also. Upper surface of the tibial condyles. Intercondylar area gives attachment to the 6 structures. This you learn. Ossification of the tibia, you know it, primary center, secondary center, primary center for the shaft, and for the secondary center, upper end and the lower end. Okay, and fracture of the tibia. What will be the fracture of the tibia? Tibia is commonly fractured at the junction of the upper 2/3 and lower 1/3. This you remember. And lower 1/3 of the tibial shaft is bare area. So this is divide of the musculature, and have low blood supply in this area. For this reason, the fracture in the lower 1/3 of the shaft of the tibia is slow, delayed union or non-union. It is difficult for the healing in the fracture of the lower 1/3 of the tibia because of the less blood supply. So this factor also you can remember. Now come to the fibula. Fibula is the lateral bone in the leg. Tibia is the medial bone, and the fibula. For the side determination, we have discussed before in the classroom. You have to hold the fibula like holding a pen in your right hand or in your left hand, accordingly which side the tibia fibula you are holding. Okay, you have for this you have to hold in the malleolar fossa, which is lying there in the lower end. Lower end medially, what is there? There is the malleolar fossa. So there you have to hold, and with the help of this you can determine. And general feature here, upper end. This one is the upper end, this one is the lower end, and intervening shaft. In the upper end, you can see facet for the tibia to form the superior tibiofibular joint, isn't it? Here, this one is the neck. Neck is very, very important of the fibula because the lateral part of the neck, there lies the common peroneal nerve, isn't it? And here, lower end of the fibula articulate with the talus to form the ankle joint. So this also you have to remember. And the borders are 3 here again. Anterior border will be there, and then what's in the border? Posterior border will be there, and the border will be the interosseous border. Okay, and there is and the important structure, nutrient foramen. You can see the posterior surface. For this, you read all these special features like the attachments of the muscles, which muscles attaching where. I'll take you into this ossification of the fibula. This fibula ossification is important because this violates the law of ossification of the law of ossification. Okay, what is this violation? You can read here. Okay, in fibula, law of union of epiphysis is violated law of union of epiphysis violated. What is the meaning of this? According to the epiphyseal center or secondary center, which appear first, unite last with the diphysis. This is law of union of epiphysis. In fibula, epiphyseal center for lower end appear first and also unite first. This is the violation. Which appear first, also unite first. Okay. Actually, it should unite last, but it is uniting first. So this is the law of violation. Violation of law of ossification by the fibula. There will be bone grafting of the fibula and fibular fracture. You can see here in these diagrams. And these bones you learn. Okay, all the bones of at least name you have to learn of the foot bones: talus, calcaneus, cuboid, and then navicular, cuneiform bones, and metatarsals, and phalanges. Okay. Here I don't want to discuss in detail, and there will be fracture of the neck of the talus, uh, and then there will be calcanean fracture sometime. This also we can learn, and fracture of the metatarsals also will be there. So this is yes. With this, it will be completed the revision of the bones of the lower limb. Already discussed in detail, so that I have gone quickly. I think this will give you the quick review of the bones of the lower limb. Okay. So now I'll tell the attendance. Just hold there, and then time also not there. Already 11:58. You have to, I think, go. No, there is no other class. Any doubts you have, you can ask now. Since you are not going into the other class, you can ask me the doubts or confusion regarding how to prepare the examination for the now for the osteology. Okay, there is talk going on regarding taking your examination in online. Okay, university actually send a message to prepare the students for taking the examination in online, but it is not decided till now. It will be when it is taking. Okay, it is not decided. So if some notice come from the university, we will share to you, discuss to you, uh, so that you please do not forget reading your first year thing. Okay, for the examinations. Anytime means like giving just a gap of 1 week or maximum 2 week of the time, there will be the examination, so that we are doing this quick revision of the things which we have discussed in the first year of for making you to prepare for the examination. Okay, so any questions here, any questions you want to ask uh, in the bones of the lower limb? No questions. Okay, then no problem. We have already discussed in the class also. I think you know all the things. Okay, which you can answer easily if your exam is also holding on the online system. Then this much for today. Yes. Bye.